everybody. Uh, Friends, we are in a first of all, good evening, and I am Dr. Sundar from Bellary, Karnataka. I'm sure all of you will agree that we doctors are in a very what we can say at the crossroads because uh, this corona pandemic has come as a sort of surprise to all of us and has taken us into a very harsh reality of what life could be. I'm sure we are already almost 4 weeks into our lockdown, and 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 we've had to face a lot of tough situations which we have never faced before. And this has taught us lot many lessons, and we all know that simple measures like social distancing, which was never done before, has been given a lot of importance. Although it was said for us a lot of years ago that we have to do this, it had not been followed, and now we are forced to follow all this. And it is important that we also inculcate this into our daily routine of social distancing, hand washing, wearing a mask, and taking personal precautions when we are seeing patients. We were never used to a clinical medicine with wearing a mask, a visor, wearing a mask, visor, gloves, and then seeing patients. But we are forced to do that in the present circumstance because uh, the situation is demanding that we give a lot of importance to all this whilst we are seeing patients, because we never know that we'll be encountering somebody who is asymptomatic and who can give us disease, or we can give the disease to others. um, I know it's a very difficult phase because district administration tells the private doctors to keep the hospitals and clinics open. Our hospitals or clinic could act as a hotspot. So to prevent all that, we need to take adequate precautions of both our hospital staff as well as ourselves, as well as the patient. So it is life has taken a complete turn for all of us during this period of COVID pandemic. All I urge our fellow colleagues is stay safe. Make sure that you take personal precautions when you're seeing patients. Don't be over enthusiastic, and we'll continue to do emergencies because we continue to serve the needy. But also take care of you as well as your hospital staff. One. Second, you also take care of your family members, your parents, your kids, because we don't want to carry the disease in the hospital back into our home space. And also, we should all try to do a bit to the society, either in the form of giving some dry ration to the poor people, or supporting your group D staff, or also going and serving the community around your house or around your hospital. So let's all try to do a bit to fight this pandemic of corona, and also let us all make sure that we give our best of services at this difficult moment to both the patients at large and also to our family. All up to us to fight the disease, and it's not only the doctors who are at the front. I'm sure doctors are in the forefront, the healthcare workers are in the forefront, doctors, nurses, paramedics, they're all in the forefront of fighting this corona. But we can't fight this alone. We have to do it with the general population. We have to do it with the general public as well. It is important that the public understand the importance of wearing a mask and going out. In countries like South Korea, Japan, Czech Republic, they found that wearing a mask and going out, apart from maintaining your hand hygiene, maintaining social distancing, they have been able to reduce the number of the corona cases. So important that the public at large understand the change in the social behavior that they have to adapt, not only now, but for the rest of our life, because this corona disease is going to stay for years to come. And it is not just the behavior change of one day. We have to keep in mind that we have to have this behavior change for quite some time. We are standing in a queue. We maintain distance when we are buying vegetables. We maintain distance when we are standing in front of a medicine counter, anywhere. We make sure that we don't stay very close to each other. We don't crowd in places, in public places, so that we don't spread the disease from one to another. We all know that this is a communicable disease, so it is our bit to make sure that we don't give the disease to others. Always wear a mask is very important. That is a behavioral change that all of us should inculcate. Not only now, I think so. When we go out, we make sure that we don't stay close to each other. And especially when we have a cold or a cough, we make sure that we wear a mask all the time so that we don't give this disease and spread this disease to others. It is important that you visit your doctor if you've got any problem. But in this period of lockdown, you visit a doctor or a facility only if it is very, very essential, because you don't want to be crowded in the hospital and make it as a hotspot. You don't want to get the disease from other places. So make sure that you visit your doctor only if it is really, really urgent. And telemedicine, or right now the teleconsultation, what we call, has taken a huge leap. You can definitely, if your local doctor is able to give you a telemedicine consult, then that will be ideal. You can get telemedicine. But if in case there's an emergency, please don't hesitate to visit your doctor, visit your facility, because doctors are always there to take care of emergencies. And I'm sure doctors will not discourage you from coming to the hospital in case a need arises. So friends, let us do our bit to fight corona. Let us fight it together. It is not one person cannot fight it. One leader cannot fight it. We need all of us to strengthen, to put our hands together and fight this corona, because this is a communicable disease. This is a pandemic right now. It's a different situation altogether. We've never faced this situation before. We don't know how long we have to stay like this, but I suspect that we have to be like this for the good. Hand wash regularly, wear a face mask. Whenever you go to a crowded places, make sure that you maintain a social distance, don't crowd, and also make sure that you stay healthy by doing some sort of physical exercise every day within your house. Stay home, stay safe, stay healthy. Thank you very much.